Hi, it's Dr. Buford. We're just getting started on the left knee here. We're trying to focus the picture for you. Too far the other way. That's pretty good. So as we look in this posterior compartment here, posterior horn rather, of the medial compartment, we can see that the meniscus is not in that bad a shape here. We've already been smoothing some things out in the compartment, but this doesn't look too bad here. So that's actually encouraging. We can look down here and see the tibial plateau is pretty smooth. You can see a little loose piece of cartilage right there. We just used our suction to remove it. But for the most part, the meniscus looks like it's in pretty good shape here. Now as we look over in the middle of the knee, this is your anterior cruciate ligament. There's some little evidence of a prior partial injury here. You can see how these fibers split apart. But your knee was stable on examination, and we can see that the ACL is running up in the right direction here. So your ACL is this structure here. It runs up and attaches laterally, just in the same direction as my shaver there. And what I'm looking at here is some of these fibers. You can see there's some evidence. You can see right there, I can just put my shaver right into the ACL, which isn't quite normal. Normally it's like it is over here. So there's been some partial injury, but again, your knee was stable, so I don't think you need any kind of reconstruction at this point. I'll tell you, the next thing we're going to do, we're going to look in the lateral compartment in just a minute, after we probe this ACL a little bit more closely. Okay, so there's a little bit of fraying on the inner horn of this lateral meniscus. A little bit more inflammatory synovium over here too, so that goes along with there being a little bit more of a issue in this lateral compartment. I'm trying to get the camera back in where we want it here. See if we can't breathe some of this synovium so we can see a little bit better. Spend a little bit of time smoothing out the inner horn of this meniscus. We'll keep working. I'll show you some more in a little bit. Pause. Okay, so as we're looking here, you really haven't lost that much cartilage. A little bit of fraying on the tibial plateau, but not that much. So again, that's encouraging. So the next thing we're going to look at here is your kneecap or your patella. And as you look at the top of the screen here, your patella is at the top, above. And we can see you've got some patellofemoral chondrosis here. Maybe that's what's causing a lot of your symptoms. So we'll spend a little bit of time trying to smooth this out for you, possibly. Alright, so we're going to finish up here and get you back to the recovery room. It's pretty vascular. You can see you've got a fair amount of... Can I get a live weight, please? A lot of vascularity, which is just a fancy way of saying there's a lot of bleeding from the synovium, just because of how inflamed it is. And I really think most of it's coming from this patellofemoral area. So we'll try and take care of that too, possibly. Looking up here, we're now looking from the medial vantage point, and just make sure that there's no bleeders, and we've inspected the patellar cartilage from this angle. So it's really down at the inferior pole where you've got this little bit of chondrosis down here. And we've done our best to smooth it out. So we're going to get you back to the recovery room shortly. I really hope this does the trick for you. Good luck to you now. Bye-bye.